Welcome to Dr. Mary Travelbest's Independent Travel Guide special episode. This is a special health episode, our first ever. It's for women who travel, who want to travel, and especially for those who want to travel independently and being healthy. I wrote and published the best-selling The World's First Guide to Independent Travel, and since 1993, I've been running a marketing business, raising 4 children with my husband, been a university professor, and all of the above. So in this episode, special health episode, it's how to stay healthy in a crisis. The destination is not Wuhan, China. And the mistake is bugs. Yes, scabies infested my body. The tip is ways for women to travel independently to stay healthy. So my first health question is, people are asking me this, how do I stay healthy? So if you are in a crisis about health, be sure to do your research and study what is the situation. Keep aware of all the latest news and assess your personal situation for travel. Each person will guide their own health. So if you are a high risk, you will need to take greater precautions. You'll have less risk and more care. Now, if you're low risk, that's great. Try to maintain your level and stay that way. Don't participate in high-risk behaviors or believe that you're not vulnerable. So here's what you can do today. I've got a short list. Number 1, wash your hands often with soap and water for at least 20 seconds. And if soap and water are not available, use an alcohol-based hand sanitizer. Now, avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Stay home and cover your cough or sneeze with a tissue, and then throw the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Today's independent destination is not China this season. I just spoke with my daughter who lived in China for 2 years and in Taiwan for 2 years, and she's there now. And she says that things in Taipei are okay so far with the coronavirus, although there are no face masks available for purchase. She said there are deaths so far in her country, and she's not wearing a mask currently, but she did not rule that out. The numbers of cases in China continue to rise, currently above 50,000 reported worldwide as a result of what started in Wuhan, China, among underground services. And when you listen to this, there could be many different consequences to this health circumstance, which is worse than and follows the SARS by a couple of decades. So I am not a medical doctor. I'm a business doctor, so please don't take any medical advice from me. I just want you to be protected, careful, and safe wherever you are. I don't want to cause unnecessary caution or worry, but I do want you to live with the promise of the future that we will one day live in peace eternally. The best advice, if you are away already, or you are thinking of travel to Asia especially, look at the U.S. State Department website and follow the advice by region. What it says now is, quote, do not travel to China, unquote. This is the 4th level, red in color. They would not like you to go there if possible from the U.S. So what can we do? We can invest in modern health technology to screen risks. We can conduct vaccine research. We can educate and allow real-time information across borders. I'll have more information in the show notes for you. So let's talk about today's mistake. That's my mistake. And that was also about bugs. It was about scabies. What was bugging me this past year was scabies. It's a serious and health risk. My primary doctor sent me to the dermatologist where I was confirmed to have this. So scabies is a skin infestation caused by a microscopic mite that lives in the skin, reproduces on the surface, and then burrows in and lays eggs. It causes an itchy red rash. How could I have avoided it? How could I have diagnosed it sooner? These are 2 questions that I can't answer. However, I want to let you know that it was very contagious and was very difficult to remove from my body. So if you think you may have an itch that spreads and does not go away, it could be this or something else. So get it checked out. I should have gone in sooner. At first, I thought it was lice, but later learned that it was very different. So I hope you don't get anything like it. Now for today's travel advice. Here are some ways to stay healthy. Number one, keep your common sense with you. Don't overdo it on anything, including alcohol, medicine, or your exercise. Drink plenty of fluids, especially water or healthy drinks. Cover your mouth, nose, and even your eyes, and eat in known places and get the sleep and exercise you need. Keep up with your routine as much as you can and pray for a speedy recovery for those who are ill. So thanks for sharing this special health edition of the world's first guide to independent travel. I want to help women travel. That's my goal. So send me your travel questions so I can help you and help others too. Also, let me know what's on your bucket list.